What we have been doing is, as the 2 days have progressed, we have been adding, based on the presentations, to some notes that I'm going to present right now. And remember, we talked about having a guide, a tool, a resource that we can give people that really itemizes a lot of the components of an effective drugs and driving program, and then some of the key questions associated with each of those components. What I'm presenting is completely draft. There is no sacred cows. I think it's up for discussion at the end when the presenters have outlined their 3 points. So I will, right now, I'll take a few minutes to go through where we are at since yesterday morning, the notes, the questions. Then we have some people that will be adding to it as we have the presenters make a few final comments. So we have the group, and each of them are going to be given 3 minutes each, essentially. Otherwise, the floor drops. But they will be given 3 minutes each to present. If they had to make one, based on the last day and a half of discussion, what would be the key areas of focus that they would give to the whole drugs and driving issue? And as they do that, there's people like Amy and Anna and Doug and Ross that will be incorporating some of those comments in the presentation that I'm about to give. Okay, so again, this is where we are at based on a day and a half of work. Interrelationships. Any of the components that we have discussed for the last day and a half, I just want to draw the attention that they're all related. So the first one on L&P is legislation and policy. DD&E is detection, deterrence, and enforcement. The bottom there is A and S. What was that for? Adjudication and sanctions. HI is health interventions and treatment. And PA and P is public awareness and prevention. And we're going to talk about all those components, but again, it's really, they're all interrelated. What you do in one area will be linked to the next area. So in terms of legislation and policy, and again, these are the questions that came forward based on the presentation. What is the purpose of the legislation related to drugs and driving? So for any one country that is looking at this, or for any one province, certainly in Canada, is it all about road safety, or is it about drug control policy, or as we also heard in the last day and a half, or is it about both and trying to find a balance? What do we mean by a drug? Are we talking about an illegal drug, a legal drug, or are we targeting certain drugs, which is a bit of both? What is the problem we are trying to fix? What is the concern? What is the prevalence in drugs and driving crashes? And we certainly spent quite a bit of time yesterday morning talking about data and data collection, what was missing, what should be there. But the bottom line was we really, in each of our areas, need to define and substantiate the problem of concern. And also do what we heard this morning, a cost-benefit analysis. We need to have data collection surveys, fatality data, non-fatality, crash data, roadside surveys, relative risk data. And also we heard that we really need to build on existing health surveys to monitor trends over time. Also what we talked about is what are possible key considerations for legislation and policies. Again, this was yesterday afternoon. Is it really the presence of a drug, or is it impairment by a drug? And the presenter yesterday afternoon talked about impaired-based approaches versus present-based approaches. And then, of course, we need a regulatory framework for enforcement practices. Again, if we decide on per se laws or zero tolerance laws, administrative sanctions, mentioned this morning about therapeutic justice. And again, someone said at the beginning of a presentation this morning, we also need to ensure that it's enforceable. When we talk about detection, deterrence, and enforcement, some of the questions that came up, some of the points that were made, how do we implement the legislation? Again, that question, when we're talking about detection, is it about detecting and sanctioning impaired drivers, or is it about sanctioning drivers for using illicit drugs? Should we focus on general or specific deterrence? And the answer to that question then determines what you do in public awareness and prevention. How best do we do that? Do we have the resources available for detection and deterrence, such as random drug testing, impairment testing, DEC programs, DRE, What is the body sample that we want to look at? Urine, oral fluid, blood? What are the trade-offs between which sample is best and what is feasible? What testing and screening devices are available and scientifically proven to ensure accurate results? And again, someone mentioned yesterday afternoon, but we must be conscious of the fact that drugs keep changing. So again, when we're looking at detection, we need to look at tools that really address the patterns in drug use. What is the role of the police? And again, the presenters yesterday mentioned, is it really all about just suspicion, or is it about random, as we heard yesterday and today? And then what are the implications of the detection mules to be used? Again, we had this morning a presentation, some are more expensive than others as one example, but we also need some specialized training in order to develop the skills for detecting the drug-impaired drivers. To continue, again, this was obviously a large component because we also talked about toxicology and who are we testing. And some people tested for some things, some others. But essentially, we need to answer the questions. Are we testing all those who are where there's suspicion? Are we testing all fatalities, all non-fatal crashes, all injured? The question came up, those hospitalized or not hospitalized. When we talk about the toxicology protocol, what is the protocol for testing samples? What is the panel of drugs that we are going to be testing? And again, we have to arrive at a decision. What is the detection thresholds for each? Are we using accredited facilities, labs? And what are the capacity issues? When we come to adjudication and sanctions, and certainly in our country, you can have all the best tools in the world, but unless you present the evidence properly, it can be thrown out quite easily. So again, you need screening devices that are scientifically proven to provide the accurate results, because that certainly will come into the system, the court system. Specialized training and experience, evidence collected, as was mentioned, in terms of almost a graduated collection of evidence, consistent toxicological testing, and again, the protection of the driver's rights. The range of sanctions, we had a long discussion this morning on that one, and we talked about escalation in sanctions, which is dependent on the number of offenses and the risk profile of individuals. One of the key questions is, what is the minimum effective sanctions? And we have to address that. We talked about a number of options underneath that: incarceration and or probation and or mandatory treatment programs, educational/awareness problem recognition programs, alcohol interlock, vehicle impoundment, fines, compulsory testing for presence of drugs for a period of time with positive results associated with incarceration. What I'm referring to here is a few times over the last day and a half what came up with sobriety 24/7. So is there something that we can do taking that example and applying it to drugs? Health interventions and treatment, this is a component that we talked about but doesn't have a lot underneath it. So the question for later this afternoon after the presenters is, do we incorporate it under adjudication and sanctions, or do we continue to keep it as a component separate? And the discussion was, does the range of sanctions offer options for substance-dependent drivers, recognizing that addiction and substance use disorders is a brain disease requiring treatment? And how do we implement then compulsory treatment options, and when and to whom and for whom? Public awareness and prevention, the final, second final slide. What is the purpose and the program's approach to be taken to support the legislative changes? So again, it goes back to that first component. Is it all about increasing public awareness about the effects of drugs and driving, but moving towards behavior change? What are the key messages to support the purpose? For whom, about what, and in what form? We heard different forms. We heard social media campaign, mass media, directly health professionals. We need to consider targeted messaging and strategies for specific subgroups and substances, i.e. seniors, youth, adults, parents, or cannabis, opiates, benzodiazepines. And what are the lessons learned, proven elements from such things as other communication strategies associated with smoking, seatbelts, drinking and driving, and different models of behavior change, as Doug mentioned, and also deterrence theories that we also heard about that can be reflected in the messaging. So I've just summarized all of the components that we have talked about for the last day and a half. And again, maybe they're not the right groupings of the components. We can have that discussion after the panel members have presented. And the last thing before we leave, we'll talk about is where to from here. But before we get there, we'll now give an opportunity for everyone to say, again, 3 minutes of what would be the top 3 things to focus in on if we really were to address the drugs and driving issue. So, Faye?
Thank you. That was a very comprehensive summary. But let me begin by going back to this program. As you can see, it says a complex agenda, and it is absolutely complex. And from where I come, we look at this issue as a twofold issue. It is a public safety issue as well as a public health issue. And throughout the discussion on the last 2 days, these two have come up and occasionally would come at odds with each other, but that's just part of the complexity. And in thinking about the U.S. Legislation and policy, there's actually a two-level thing going on here. The federal government has policies, but in terms of actual legislation, each of our 50 states have to develop their own. In fact, there are 50 different ways to do what we are talking about here. The federal government is encouraging, per se, laws, but in order for that to happen and to be successful, we need to be supporting the development of testing standards, which we do not even have as a country, for the various substances that we should be testing for. There is work that's going on. Testing standards have been drafted and are under review, but they have not been finalized. We need to be working with industry to develop the appropriate oral testing kits so that the state laws and any other regulations are enforceable within a reasonable framework on the roadside. And as you probably got a flavor of earlier yesterday, there are many different ways to do it. And in the States, there's 50 different ways of even just reporting what happens to dead drivers, much less to the other drivers that may or may not be impaired. So what we are moving towards, or what we need to move towards, is the development of technologies that are appropriate to support the enforcement of whatever legislation gets put in place, or in some cases they already are in place, but we don't have a complete toolkit. We do have drug recognition experts and training to increase the pool of DRE certified police officers, but that's not enough. We need other pieces to come into place. For developing the risk profiles that are associated with specific substances, there is some work that's ongoing right now. There's simulator studies that are funded by NIDA on marijuana, specifically on marijuana and alcohol, out of the University of Iowa, which we hope will bring clearer, develop a clearer picture in that direction. And the bottom line is that all of these efforts that we are engaged in are incremental and often very slow. But we do expect to take 2 steps forward and 1 step backward. I think that is generally the case in how we make progress in these things. And there's this whole continuum of interventions that we have to study, from prevention for the very beginning users who might get into trouble, all the way to the more criminal justice-oriented sanctions. And this whole range of interventions has not been fully developed as well. So we have our work cut out for us.
Thank you. I'm just going to go down, not in accordance with this. How about Martin is next? Which it might be easier. Thank you.
Thank you, Rita. I think where we do have consensus is, firstly, that it's a road safety priority. I think our politicians, policy officials have a duty to protect other road users first and foremost. So the question is, how do we do that, and how do we deter drug drivers from continuing in that behaviour? I don't believe that we can deter them through campaigns only and public awareness campaigns only. We have to increase enforcement because a drug driver has to have a belief that they have a reasonable chance that they might get caught. So I would like to see a move towards more use of technology and roadside oral fluid testing. I think there's evidence that in Victoria and other Australian states that they've been using them quite successfully now. So that's the first point. And I think you've got an opportunity is not to get in the position that we got in the UK, where we had to make a knee-jerk reaction to a particular event, i.e. the Groves family incident, but plan it with your politicians to see what they actually want and how you best get convictions. You need to have a legislative and enforcement process that is watertight, so that people can't get away with it, so that it's seen by both the police and the public as credible. Where I think there's still a lot of debate and discussion is around, once you've caught them, what do you do with them? What are the sanctions? And I'm quite attracted, I'm not speaking on behalf of the UK government here, I'm speaking sort of personally. I'm quite attracted by the Victoria state intervention, where if it's a young first offender, they basically get a smack. It's not too punitive. Don't do it again. And if they do it again, then obviously the sanctions increase. I think in the UK we've got a very sort of quite a punitive approach at the moment, where first offence is 12 months disqualification. Now I think in a rural society, which is New Zealand is quite largely, that's going to have quite an effect on somebody's ability to continue down a career, etc. I think in the UK, if I was to lose my licence, it probably wouldn't impact too much because we've got quite a developed public transport system. So I think what I'm kind of getting around to is that each country's got its own problems and its own issues to deal with, and I think how you develop your sanctions has to reflect your values and your issues. So I think, just to recap, I think we've got a consensus that we do actually need to deter drug drivers by actually increasing enforcement, but I think the debate is still out about what you do with them, and I think it's for each country to come to its own conclusions.
I'll stay here. Okay. With your permission.
John Lacey is next.
Well, I have some unsurprising suggestions of what I think might be some priorities. One is to establish a defensible and objective risk estimate for THC and THC plus alcohol. We're sort of working in the dark right now because the estimates are all over the world in terms of where the estimates come from and what their results are. And I don't think it's geographical differences. It's methodological differences. My study, just because I didn't get to make my point earlier, is based on crashes of all levels of severity. And it's not really my study, it's NHTSA's. So a lot of the other studies are based on severe injury and fatal injury crashes. And for alcohol, that would make a difference because we know that alcohol has injury potentiating effects. People with alcohol on board with the same kinetic forces hitting them with people without alcohol are more seriously injured. The studies so far don't indicate that that's true for drugs other than alcohol. So it's just a shot in the dark to see if that's what the real difference is between the more methodologically sound studies and the less methodologically sound, but ones that come up with much higher risk estimates. And actually, some of those studies are based on self-report of marijuana use. So, and that leads into my next thing is evidential testing for the violation if the violation exists. In alcohol, we have very consistent ways to measure the alcohol worldwide. We use the same techniques and the same calculations to say what the BAC of the person is. With marijuana and other drugs, within the same jurisdiction, not state level, even but down at county and even parts of city levels, you'll have different labs using different procedures for developing the estimate for the measure of concentration or the presence of it, using entirely different procedures, and so you don't have consistent results. And any lawyer that gets a hold of that should be ashamed of himself if he doesn't get the person acquitted. We design our laws supposedly to be consistent, and we know they get twisted in how they're implemented, but this is one where it's just we need a technology that's universally adopted, and that will be a very expensive thing to do. So that may not ever happen. Faye's talked about trying to standardize the testing procedures. Well, coming up with a good standard, we haven't even done that yet. But then to get all of these thousands of labs in the US that are doing evidential testing to use the same procedures with probably more expensive equipment than many of them already have will be a very difficult problem to face, and many other jurisdictions face that as well. Again, stealing from Martin, he emphasized publicity with law enforcement, with the enforcement. Enforcement's much less effective if the public doesn't know about it. And public awareness, there hasn't been evidence of effects on crashes for public awareness programs other than ones that accompany enforcement. So I think some of these really innovative enforcement procedure, PR stuff or public awareness measures that we saw this afternoon or earlier today, some of that innovation should be applied to bolstering the effectiveness of whatever enforcement programs we have. And then we should not lose track of the fact that many of these drugs that are potentially impairing and that are used to convict people or will be used are medicinal drugs that are maybe potentially impairing, but they're treating an underlying condition that may be more impairing than the drugs themselves. And we don't want to discourage people who need these drugs from taking the drugs because of fear of legal consequences for something that's actually making them safer than they otherwise would be. So I've taken more than my allotted time, I'm sure.
Jeremy is next.
Thank you. I've only got about a minute left because John took my time. I've also come up to the lectern because my legs still work.
So far today.
Look, I've changed what I've written about 3 or 4 times. I will make the focus on deterrence. If somebody's circling some things somewhere. But the first thing I want to point out is that what works in one country doesn't necessarily work in another country. What are issues socially and politically in one country are not necessarily work in another country. And I look at the issue of drink driving, and I think Australia and New Zealand are similar in this way. We actually don't have problems with random roadside breath testing. It's not a civil rights issue. We quite freely give up those sorts of rights to have a much safer road, but don't fiddle with our drinking behaviour, right? We've not fiddled with people's drinking behaviour. We've fiddled with their driving behaviour whilst they were with alcohol, and it's a very different cultural and community concept. We have no problem with it. So taking from that, there's some learnings. I'll go back to originally I talked about. I do think we need people from the drug use area. However, also from that, we do need people who understand road safety as well. And if we go back to this drink driving issue, the key issue in those countries that have had successful roadside drink driving programs, and I put New Zealand at that, even though you've just dropped down to 0.05, is that it's the focus and success of those programs have been on deterrence. So therefore, the deterrence programs are not necessarily about testing as such. It's where testing fits into the concept and the perceptions of testing within the community. So things have to be considered in terms of drug driving, in terms of one of the possible things is you consider drug driving in a similar way. So therefore understanding drug use is essential. However, you also have to understand the concept of deterrence. The key finding in the long history of random breath testing is exposure. That is, the number of highly visible roadside tests. That leads to the concept of deterrence. Therefore, the goal should be large-scale roadside programs where people think that could be me in that net that goes through the roadside checkpoint. Then the next step is, if I do get pulled over, I will be tested and I will be caught. Or eventually, I will get pulled over. Now that's, in summary, and people may correct me, has been a success in Australia and New Zealand on what we would call our successful random breath testing programs, and we're still doing that. I would, what's that? I've turned the page incorrectly, sorry there. My next point I'd like to point out is, what do I want to point out? Sorry, I've really, the goal should be large table caught and the pulled over. Okay. The what we've also done is years of alcohol. Okay. The research that was quoted earlier today about people thought, say in response, I'm a good driver when I'm stoned, I only use a little bit and I wait for half an hour. Yes, you are correct. We did talk about that with alcohol 30 years ago. We've actually changed that. It took 30 years, 25 to 30 years random breath testing. It took that. We did change that in New Zealand. We have changed that in Australia. The research that you talked about also, I found in Queensland about 10 or 12 years ago, where people said, no, cannabis doesn't affect me when I'm driving, I'm a good driving, they don't test for it, so I'm not going to get caught. We found that about 10 or 12 years ago. And 10 or 12 years ago, we said 25 years ago, they were talking about that with drink driving. However, we don't necessarily find that now. People do know that it is an impairing drug. They do know that they are impaired. So we actually have changed that across Australia in the last 10 years. However, our next 10 years in Australia is about changing that belief, and it's changing that belief that it is an impairing drug to actually now focus on changing the behaviour. So we have this cultural change in drug driving, that you do not change whilst you use drugs. So what is my recommendation for New Zealand? If you look back, basically, if you focus on deterrence, the message would be that New Zealand does need to get some sort of roadside program in that focuses on general deterrence, where people think that they will be caught, and if they get picked up, they see it often enough, and that they will be caught in that net. However, what does that mean? Well, in simple terms, for a population of 2 million, 4.5, sorry. That was a deliberate, because it's the same size as Queensland, 4.5 million. A population of 4.5 million, which produces excellent rugby union players, I must say so. And that is a bane for most rugby union countries in the world. Basically, what does that mean for you? It means that you have to get at least 50 to 200,000 roadside tests per year, and they have to be operating for about 10 years before you're even going to get people to think that I can be caught. I know it's dangerous and I can be caught. We've just got to that stage in Australia. Our next 5 years will be our profit return, where people will be making the cultural change, where people say, okay, you might be using drugs, but you don't drive. So my message in there is exactly actually what I started off with, was to say, you can sit back for the next 5 years and keep thinking, or another 10 years, but so it'll take you 10 to 20 years. So we do know some areas that work. You don't have to eat the whole apple. You can take some bites off, but you need to start moving. Also, my final point is, if you are going back to look at the concepts of deterrence, people should go and read Ross Hommel's work. It's not just the drink driving experience of operations on the roads, it's the discussions that we had about drink driving. And drink driving, we had very similar discussions about, you're changing our cultural behaviour. So people have to go back and look at those early discussions we had, not just about what the roadside program is about, writing legislation. Thank you.
Phillip Swan is next.
Right. I believe in doing things, and by that way you may get it wrong, but you actually have to act. And so I'm speaking from an Australian perspective. I'm not really addressing your problem in New Zealand, but we've been asked to give points for advancement. And so from an Australian perspective, I think the first point is one company has had a monopoly on the supply of the first roadside drug test and has not dropped its per unit price despite sales of its product going past 1 million units. So finding a competitor, an alternative first screening tool, is a key need for all Australian states, and I think that would be a first big advance. The second big advance is that we are, as a bureaucrat, we put up rational arguments and rational sentencing options. What actually happens is the Herald Sun puts in going soft on drink drivers, drug drivers, and the politicians, this is being recorded, and the politicians who are right and are the voice of the people seem fit to ignore the evidence, the scientific evidence. So what we've been trying to get implemented therapeutic jurisprudence for over a decade now. The magistrates fully support it. They fully support an offender being sentenced to treatment rather than punishment, provided they have enough evidence of the problem. So my next second thing that I would like to advance is having an introduction of modern low-cost hair analysis to identify offenders who have regularly consumed high doses of drugs over recent months, not just a once-off offence measure. And I've been assured by the magistrates, if every offender who comes up with a hair analysis that proves they have used and consumed regularly, they will get treatment, not punishment. So that's the second thing that I'd like you to consider. Thank you.
Mark Kleiman is next.
Yes, I want to apologize for my intolerable level of silence over the last 2 days. I know everyone here has been desperate to learn what I think and has been deprived of that. Let me start where I started yesterday. Seems to me the principles we should be acting on are safety, administrability, and justice. And what I've learned over the last day and a half is that it's going to be very hard to have any of that without strengthening the scientific basis. I mean, I've sat here and I've had people who are way above me in statistical chops tell me firmly that alcohol and cannabis combined are a fantastically dangerous combination. And alternatively, that there's no evidence that cannabis adds to the danger of alcohol. That needs to get worked out at some point. I think we should not assume that chemistry is going to be the primary basis of roadside testing. It may very well be that we can do psychometrics instead, After all, we're interested in the chemistry primarily as a window on impairment. If we can measure impairment directly, then that seems to me like, in many ways, a better way to go. I think we've had not enough discussion today of the cascade of tests. Right? We need a system that's logically worked out of screens and confirms. For screens, you want cheapness, swiftness, non-invasiveness, and sensitivity. Confirms can be slower and more expensive, but they need to be specific as all hell. We heard earlier today that a well-trained police officer can be about 95% correct when he identifies somebody as being drug impaired according to a series of field sobriety tests and related activities. I just remind us that 95% is not beyond reasonable doubt. Nobody should get a criminal conviction of something he's 19 times in 20 guilty of. That seems to me like elementary justice. Until we know better what the science is about impairment by alcohol and other drugs, it seems to me a simple rule might be that until we're pretty sure that something has a relative crash risk greater than speeding, we shouldn't punish it more severely than speeding. That is to say, as a traffic offense rather than a criminal offense. It seems to me the rush to criminalize something where we're getting serious debate about how dangerous it actually is not justified unless we want to simply make traffic enforcement an extension of the drug war. Not all offenders are alike. We keep hearing that and then sliding by it. Some are dependent and some aren't. They require different sorts of handling. Some are violent and some are not. And I think, again, we've got now one study's worth of evidence suggesting that they require different sorts of handling and that we ought to think about incorporating our drunk and drugged driving program into our broader law enforcement context for those people who have non-driving criminal histories. This may be a very good way to pick up people who are doing other sorts of mischief. And finally, and this has been said before, how aggressive we should be about testing depends in part on what our response is going to be. And again, it seems to me that response ought to be proportionate to the risk that that person has inflicted on the society, and also effective. And I think the evidence that for a very large fraction of the people who drive under the influence, they can be caused not to drive again under the influence and possibly to abstain from other mischief by being required to abstain from their favorite drug for a while. I think that evidence is now strong enough to warrant field testing everywhere in the world rather than just in South Dakota. Thanks.
And Rachel will have the final words.
Thanks very much. I just wanted to make a couple of observations that sort of came through to me in this, and that was the need, I think, for us to, in our policies, to be very clear on what our policy intent is and what problem we're trying to solve. This issue has come up a number of times in terms of the issue of road safety objectives versus drug control or moral outrage about the use of illicit substances, and I think we do need to be very, very clear when we put up policies what exactly the problem is that we're trying to address, because that will help define the solutions that we have. I wanted to make a point that I think Kerry Griffiths made, and that was, we know that under the currently available technology, drug testing is very expensive, and he raised the issue about the risks of possibly diverting some of our effort away from alcohol enforcement in order to address a new incoming problem we might perceive with drug driving. And I think we need to be very careful if we do that. Do we end up with a net gain, or are we going to, by taking, if the money is tight, which it always is, that we don't end up losing more than what we gain. The last point I'd make is the plug for better ways of addressing people who might have substance misuse or abuse issues. I don't think in New Zealand that, as far as the driving, that we do it as well as we could, and it's one of the areas that we'll be looking at in one of the other reviews we're doing. I did like the concept of the triage approach, where we're not sort of necessarily funneling everybody through an expensive and time-consuming assessment. If we could intervene at some point and decide or determine who needs what, that would probably be a great advance in terms of using our resources more effectively. That's really all I want to say. Thank you.
Thank you very much for all your points. We have added them in red, so when we go through each component, before we you step down, are there any questions for any of the panelists up here? If not, then thank you very much. Thank you.